Welcome to the Healthcare Success Podcast. And today I have two more distinguished guests that I know from working with in the past. And I'm really excited to meet them. We're going to be talking about rare disease today. And this is a topic that is its own sort of special niche. And I think you guys are going to have some great comments. I'm really looking forward to it. So today, to introduce my esteemed guest today, we have Sugata Biswas, who's managing partner and co-founder of Cadence Communications and Research. And Emily Anderson works for the same firm. She's Associate Director of Patient-Centered Research. Welcome, both of you guys.
Thank
Great.
you.
Thanks,
I,
Stuart.
I want
Thanks.
to work with you guys again. No, it's great to have you. So thank you for joining me. Glad to have you guys. So first of all, we're very informal here. So feel free to tell me a little bit about your company, what you guys do, what's the sort of point behind it. That'll help ground us for all the other questions that are coming because you have a very specialized company. I'd love to hear a little bit more about that.
Sure. Hey, Emily, maybe I'll start things off and then kick it
Sure.
over to you. Great. Hey, so first of all, thanks for having us on this, Stuart. Really appreciate it. My name for everybody out there is Sugata Biswas. As Stuart mentioned, I am one of the founders of Cadence Communications and Research. We are a healthcare focused professional services company based here in Southern California. We do a lot of work across healthcare, so not just focused on rare disease, but also other, mainstream diseases, neurology, oncology, a lot of things. And we provide services in two basic areas. So market research, what we call clinical and market insights, and then also medical communications. So we are the people that would help organize advisory boards, meetings between manufacturers and doctors or patients and doctors. We really see ourselves as helping people make better decisions in the healthcare space, be they patients, caregivers, physicians, manufacturers. Emily?
Great. So my role with Cadence really has been mostly working on the market research side, a lot of recruiting, a lot of finding and making connections within that space, whether it's caregivers or physicians, patients, and all of that sorts. I've been with the company for about 10 years, and my favorite part of the work that I do is really connecting with patients and caregivers.
That's great. And we certainly enjoy having you both. And I had the pleasure of working with both Sagata and Emily on a rare disease project, which is what inspired this particular, the success that you guys had with that project inspired the idea for today's webinar, or podcast rather. So the I'm really intrigued by this topic, and I'd like to start because this is a call we get from time to time, and rare disease, as I said earlier, seems to be its own specific niche. It's its own world. And so, why are the rare disease communities and people, so different and so difficult to reach?
Sure. Maybe, yeah, just to jump in really quick at first, it might help, Stuart, if we just take a step back and just think about what's considered a rare disease here in the United States. So, the Orphan Drug Act in 1983 defined a rare disease as a disease or a condition that affects less than 200,000 people in the US. There's actually a subcategory within rare disease called ultra rare disease, and that is something where the condition affects 1 in 50,000 people. So roughly that translates to about 7,000 people total in the US. So these communities are small. There's about, if you take all the rare diseases, there's about 7,000 of them, a little bit more than 7,000 rare diseases. Collectively, it affects about 30 million people. Part of the reason why the Orphan Drug Act came to be in 1983 was to incentivize manufacturers to develop products for these conditions, and it does so in a number of different ways. And I think getting back to your question, why are they unique? Why are they hard to reach? It's really based first and foremost, fundamentally on that. Like, it is very rare. This is this isn't a disease that's out there in the media a lot. It's not that there are huge organizations, going after cures. It's very small, and so because of that, the patients sometimes they feel very isolated. The caregivers feel isolated, and they really look to each other for information, for support, and they really look to the physicians to help them cope with these diseases. Emily, would you like to add to that?
Yeah, no, I think that you got it there. These are really ultra rare conditions that these people are living with. They're real people, and a lot of these people are just looking for answers, and they find a lot of their information just with talking with other people who are experiencing something similar than what they've been through. And I think what makes finding caregivers and patients within this group so difficult and so different than just working with a traditional recruiting partner is that our approach really is it's human centered. We are building trust with these people, we're leading with empathy, and we're really trying to get to know these people authentically and not just trying to survey their groups and come into their, existing communities and take away from it. We're really trying to add to it.
So that word human-centered is something that we've talked about in the past. What does that mean, especially to you guys? But like, what does human-centered actually mean? Help me understand.
Really good, and honestly, I feel like Emily coined the term for us, at least within the organization, and is a champion of it. And but just really quick, a couple of my perspective, and then I'll hand it over to you, Emily. Is for me, it's that we don't treat uh, uh, members, caregivers, patients of the rare disease communities as numbers. I think for too long they have been treated as a number. So looking at how many people are affected, what's the actual symptom when, how many people, suffer fatalities from it. It's more than that to us. These are people's lives and they are fundamentally affected by the condition. Emily?
Yeah, I mean, it's really just about meeting people where they are and treating them like humans. A lot of these people have been shoveled through the healthcare system with, multiple different doctors and specialties and appointments, and it gets exhausting. And at the end of the day, these are real people with real families, and it's affecting their everyday lives.
Part of what inspired this interview, Emily, was your success in social media. But before we talk about that, you mentioned something about not being an intruder, or I don't know if those are the exact words you used, but how do you do that? That's a gift because you want to, I'm pretty sure you're going to want to lead with empathy. And I'm guessing these people feel frustrated and probably a little suspicious and exhausted and lots of emotions. And some of these diseases can be very detrimental. So, is it all about empathy? Like, what's your sort of, because you're so good at this, the people on your
Yeah,
team,
I
what's
mean,
your
it's for
thought?
me, it's just being authentic with people and just telling them exactly who I am and why I'm interested in it. And, I've gone through my own medical hell myself, and I've gone through a number of surgeries, and I've been impacted by rare disease personally, and I've had a lot of people in my life that I've lost, unfortunately, due to cancer and other things. And I just show up to these people and just tell them who I am and why I care. And I'm not just some random person who wants to, hand them a survey and give them $20. I actually do come from a genuine place. I've walked a few steps in these people's shoes, even if it's not the exact same rare disease. I've gone through this journey personally, and it does matter to me. And I think people can sniff out inauthenticity. And if I tell them, this is where I'm coming from, this is why I care, and I think that it would be great to learn from your group and not just take from your group, but actually share my experiences and just be real with these people. And that's really the key to it. And I don't think anyone can walk in and do that same thing. Not everybody has my experience. And they're not everyone is willing to share. But yeah, I think that that's really been what has made my work successful is just being real with people and sharing my experience.
So that's really, I can understand how that would work because pharma is so big. I mean, it is just so big, and there's so much money, and there's so many people involved, and I could see how it'd be pretty easy to lose that human touch, right? It's like you're just, you're to some degree, I'm sure this isn't everybody, but this like they feel like we're not getting our hands really dirty. We're not actually dealing with these people. We're just talking about them in boardrooms.
Right.
You're actually speaking with them. You're interacting with them. You're sharing their stories and their trouble, which is a very, very different perspective. Um,
And I've been on the other side. I've been the person who's looked for support groups through Facebook or Instagram or just finding communities online. And I've been in their shoes.
let's talk about that actually. So social media. It's funny. I remember there was a book called Here Comes Everybody, and this was when the social media first became a thing. This is now probably 20 years old or something, but it was talking about the impact of it and how people um, with diverse interests could get together and, for good and ill. But in this is a case where, I think it's incredible and what an enabler. Because if you're by definition 1 out of 50,000 people, it's really hard to find people to talk to. With social media, suddenly that goes away. So let's talk a little bit about social media. What's happening today with social media? How are people with rare diseases using it? Um, what's the latest, I guess?
Yeah, yeah. I think you make a really good point about the potential impact of social media and it as a great tool for potentially creating communities and for disseminating information. The challenge I think a lot of rare disease communities have, is twofold. One is simply now the size of the internet. So there's so much out there, and there's so much noise that it's difficult to find the right group. So a lot of them are searching for information, and you've got manufacturers, pharmaceutical companies that are putting information out there. You've got influencers who are putting information out there. You've got foundations trying to disseminate get through all of that, but also disseminate, well, what's genuine, what's not, what's pseudoscience versus what's based on science. There's just a lot out there. And then you have groups like ours who are trying to talk to them. So there's just a lot of noise, a lot of chaos out there. But what's nice is that, when you leverage properly, it can create those online communities. Social media is the place where certainly a segment of the patients and caregivers in these rare diseases already live. And it's not just casually living there, but it's a real important part of their lives because once it's used right, it can be very connecting. One caregiver can connect to one caregiver in California can connect to one in New York in a very real way and share stories, get support, and feel like they're not alone. Um, and Emily can speak to how we're utilizing this channel, but really what our approach was to look at this avenue as one of the avenues for reaching out to them.
That's great. And yeah, I'd love to hear, but I'm assuming Facebook is probably the main one for you, and there's others as well. But maybe expand a little bit more about what it's like out there. And by the way, I'd also, I'm curious, Emily, your comment on to dovetail on what Sugata says in this world of misinformation, and also this world of there are people out there looking to exploit people who are desperate. So it's a really sort of, hectic scene out there. So like, give us a sense of some of these Facebook communities or other communities and, how the cultures of those, and maybe they all vary too. I'm curious.
Yeah, I mean, they're all very different, and it depends on what kind of specific rare disease that you're looking at. Like Sugata said, these are very isolated, small communities. That's rare, and so when you're in these groups, these people are sharing their experiences, and they're on there every single day. They're sharing what's happening in their daily lives. They're looking for support. They're sharing information, and they're tight-knit groups, and they don't have a lot of people in them. These are very, it's rare.
Yeah.
So.
Okay. That makes sense. Well, so, when, again, I mentioned too, like pharma has so many different resources, so many different people involved. And it's easy to really, I'm assuming, make some mistakes here when you're trying to engage with these communities. So, what are the mistakes that are pretty common, and what should people try to really hard to avoid?
I think because of the nature of social media and because of the potential for fraud, as you mentioned earlier, these communities, once they form links, they're very protective of them. They're protective of
Right.
the community. They want to keep the integrity and the honesty very much intact. So they're not super open. I mean, they're not, they're cautious. And I think a mistake that I think sometimes pharma makes, or anybody, even groups like ours, is to just come in there and start, just asking them questions or not really wanting to get to understand the group before we try to engage the group.
Okay, that makes sense.
Mhm.
Um, what are so you've done this a lot. What like give me a sense of things that you come up that may have been unexpected, something you wouldn't have found without listening first. That kind of leads straight into that question.
Sure. I think I'll start with one. It's interesting when you engage authentically, and if you can come in with a clean slate, not with a set of assumptions, the potential for discovering new things is tremendous. I remember doing one study where we were looking at part of what we were looking at was to look at how the drug was delivered to the patient. One was an existing formulation of just doing a subcutaneous injection. Another one was through an IV. And so with an IV, of course, you'd have to come into the center, go through the IV process. And everybody pretty much assumed like, well, IV obviously as a mode of administration will be less preferred than a subcutaneous injection, which a competitor had. And what was interesting is as we got to know them, as we really got to understand their story, one thing that came out was that these IV centers, these administration centers, were actually forms of community. They would see patients consistently, other patients, which they then began to form bonds. They would speak to the healthcare providers there, again, forming bonds, creating community. And what we discovered was it wasn't as negative of a alternative as we thought, and which was really surprising to us. Because we thought, oh, it's an obvious preference would be towards the less invasive mode of administration, but it really wasn't.
It's interesting. Emily, any other stories I'm really curious about your sort of war stories out in the
Sure.
field here.
Yeah, so recently we did a study on Prader-Willi syndrome. It's a very rare disease. It affects mostly children. And the hallmark symptom for this particular rare disease is called hyperphagia. It's a very insatiable hunger, and it's extreme. Like a lot of these people, these parents that I'm talking to in groups have to have locks on their refrigerators and their pantries and highly, highly monitoring every single thing, every calorie, everything that's being put into their kids' systems because they just don't have an off switch. They're just so hungry they can overeat and it's detrimental. And so when people think about Prader-Willi syndrome, that's usually what people just associate it with, and that's the symptom that it seems like all these medications are trying to treat. And we went to a conference recently, and I actually met up in person with a few people that we had met on some Facebook groups because I was working on a study. And after just like talking to some of these people and listening to some of the symposiums and things we went to, we learned that hyperphagia is really just a small piece of the puzzle. It's a big one, and it's great that they're trying to develop drugs that treat this specific thing, but a lot of these kids also have neurological issues. A lot of them are on the autism spectrum or have ADHD or some sort of other thing that's going on that sometimes is actually more detrimental than the hyperphagia itself. And I wasn't, I mean, I knew that that was a piece of it, but I guess I didn't realize how these comorbidities really were affecting these people and how important they were. And it's not just hyperphagia is, the one and done thing for this thing. It's a just a piece of the puzzle.
I have a question related to that, but I'm going to I'll pin this idea for a moment. Um, so we talked a little bit about this, but I just wondered if there's anything else about sustaining the engagement and trust. Anything else that you guys do that's really important to your success?
Emily, do you want to start?
Yeah, I mean, I think that for me, it's just when I join these groups and I actually make real connections with these people and I keep in touch with them. Like I get Christmas cards every year from
Oh,
families
that's
I've never even met
interesting.
before, and it's actually really fun to meet people and connect with them and actually be able to just build a real relationship with these people. And I know it's just social media, but I've met plenty of people that I keep in touch with. It's really fun to see these kids grow and people going on vacation and just, keeping in touch and using social media how it's intended to be social and, share what's going on in my life, see what's going on in their lives. When there's not an active project happening, I'm still a member of these communities. And if I have, I'll comment on posts where it's appropriate for me to comment. It's not like I specifically, it's not always appropriate. I don't have a child with some specific rare disease. But if I have information to share, I'm always happy to share it. If I see an interesting clinical trial or something that's happening in the news, I'm always the first to pop in and share it with the group and just get people's feedback on it, even if I'm not working on a project. And I think it's really important to just let these people know that we haven't forgotten about them, and even though we just did one project with them, um, we are really trying to create like an authentic, nice, like relationship with these people. And I think that they appreciate it. I do.
So I think that I could see, just as an editorial comment, Emily, I can so see that with you personally. I bet Emily called us for our listeners' sake with a tight deadline and things are going crazy. And we developed a friendship like instantly. And I can see why you're good at this. You just have a natural sort of empathy. So I wish I was as likable as you. I can
I don't know if
promise that.
Sugata would agree with you at
I can
that all the
promise
time.
not. Scott, you were about to say something else?
Yeah. No, no, no. I completely agree, Stuart. I agree with your statement. I think I mean, I think part of the success that Cadence has is certainly driven by the authentic way Emily shows up and does her job. But it's not just a job; it's really, a passion. It's a true love for this community, and I think what backs it up, and in terms of success factors for us, and why we've continued to engage with the rare disease communities, is because for us as an organization, our it very much aligns with our principles of being that go-between, that where we can feel like if we do our job well, if we can help information from one group to the other group, that better decisions and ultimately better healthcare is administered. I think communities, rare disease communities, feel that, and I think Emily is a really good ambassador, an example of that, of what we believe fundamentally within the company. And then also consistency, as Emily mentioned, it is important that you're not a number to us. You're not just, oh, take the survey, answer, we want your data, and we move on. It's not like that for us. And so I think all those things has contributed not just to the initial success of Cadence being in the rare disease space, but also the continued success.
So I'm curious, I'm coming back to a question I had a moment ago, and you just led me right back to it. I'm assuming you're doing surveys, so you have quantitative data, but there's a qualitative side to this from talking to these people. Do you communicate that too, and how? Because I think that's important. Otherwise, you're looking at a bunch of numbers, especially if you're following a survey and there are things that you hadn't anticipated, the survey won't cover that. So I'm curious, how do you guys do that? And is that an important part of it, this sort of qualitative side?
Absolutely. Absolutely. We in the market research space, we say that quantitative data is telling you what is happening, and the qualitative data, when you're actually talking to them, you understand why it's happening.
Right.
And what's really important in you're engaging with caregivers, with patients in rare diseases, is that you fundamentally understand. You're first of all, you come in very much with the attitude that you're trying to learn. Because if you come in that you know everything, again, insincerity and nonsense like that, these communities will sniff out in 1 second, and basically the interview's done. But we come in with an attitude that we are trying to learn, we are trying to be their voice, and we're giving them an opportunity to communicate, albeit in a rolled up, in a large context, but we do want their opinion. And what's important is when you're talking to patients versus, let's say, healthcare provider, is the language that we're using, the attitude you approach with, the language that you use, and your willingness to discover. If you're coming in there just to confirm biases or assumptions, again, that kind of nonsense, communities instantly sniff out. Emily, anything to add to that?
Yeah, I think that as we've been doing this work and we've been, working across all these different types of people and things. What I have found that's a common red thread between all of them is people want to share their experiences. People like talking. Answering a survey is great, but at the end of the day, I find that people are way more open to having a conversation and wanting to share their experiences because you can't just, explain what your day-to-day is by answering a survey. People like talking and they like sharing their experiences. And I think that's something surprising that I found doing this work because it's isolating. It's sad. Not everyone, you would think that these people are dealing with this 24/7. Maybe they wouldn't want to get on a phone call with you and talk about it some more, but it's actually quite the opposite. People really do like sharing their experiences, and I think that they like talking to people who have a genuine interest and who care.
Wow, that's great. Saga, you said earlier about the stats. I'm trying to remember how many people have one, cumulatively a rare disease. Did you say that was
So the total, so a disease is considered rare if there's 200,000 people or fewer in the United
all
States
right?
with disease. And ultra rare is 1 in 50,000 people. So it totals to about 7,000 people in the US.
Right. No, but I'm sorry. I was asking. You said cumulatively. Was it like 30 million? Did I hear you correctly?
If you combine all of the rare diseases cumulatively, exactly, it's
That's
about.
amazing. There's roughly 330 million people in America. So that's like a 1 in 9 chance you're going to have some rare disease. That's a
Yeah,
little scary when you stop and think about it. So it's
yeah,
like each individual disease is rare, but having a rare disease is not that rare. If you think about it that way, that's crazy. I
yeah.
had no idea the numbers are that big. Um, so I'd like another question that you guys mentioned that you do, a lot more than just rare disease. But I'm curious, this is not something we talked about before, but what have you learned from the rare disease space that makes you better at the more traditional surveys? Are there any things that you like because you've had this experience? Because I don't know, to me, the rare disease space is like playing in the major leagues. It gets the best. So you must have learned some tips along the way that help inform all the work you do. I'm curious. Anything like that?
Yeah, yeah. I mean, again, I'll kick things off. I think how we engage with communities. We've really learned a lot about how do we approach patient communities, how do we approach caregivers, how do we the language that we use in not just the approach but in the engagement, and then how do we create real community. I think for us, what we like to think of ourselves as we're building communities and opportunities for people to convey their insights to us that we can then disseminate to other people who are trying to develop drugs to help them. And so those kinds of processes were really instructive as let's say, we learn how to uh, build a community in one rare disease, then how does that translate to, let's say, something bigger? Like, let's say, if it's breast cancer, something really big like that. How can we take subpopulations of within breast cancer and also to help build those communities and then create that dialogue? Emily, anything on your end?
Yeah, I think that something that I've learned across tons of different projects that helps with the rare disease thing is just the way you communicate information. So some of the stuff that we're learning is very complex, and when you learn about these diseases, it's not necessarily in like English, right? It's like very complex. It's a lot of scientific jargon, and a lot of people just don't understand. So when you actually take that information, we've got a great team of some in-house PhDs that are amazing at taking these complex thoughts and all of the science and then just disseminating it into a way where we can communicate with real people who can understand it that, don't have PhDs and don't have a background in oncology and this, that, whatever. So I
Actually, I
think
have
that's
another follow-on question. I have two more questions. We'll be done here. One is that just occurred to me based on what you just said. So, watching what's happening with AI, ChatGPT, Perplexity, these different large language models, people are taking these very complex diagnoses they don't fully understand and putting them into ChatGPT. And what does this mean? And getting answers. And on the recent ChatGPT 5 announcement, there was a segment where patient said they actually decided what to do because of what ChatGPT did because the doctors were arguing. So I'm curious, is that part of the world when you're talking to people now? Do you find that these rare disease people are already like, are they consuming that too? Does that even come up in your conversation, Emily?
I haven't seen it a lot in the conversations. I know that people are utilizing ChatGPT for a number of things. I do think it has, pluses and minuses. I think it's great that people can get some information and get some things explained to them, but you really also lose the human touch, right? Like you're trusting it as much as you're trusting Google. I know we've run a couple surveys before too, where we've asked people where they get their information and what they trust the most and the least, and a lot of people don't really trust AI yet. It's
That's
still very
interesting.
new.
Yeah, for sure. Well, it's interesting. My wife came back with her blood test, and she's fortunately pretty healthy, but she's like, this was amazing. What do these markers mean? So we'll see how that evolves. Um, last thing, any final words for you guys and about this topic or any other topic? And then also, how do people reach out to you guys if they're interested in doing research in this kind of category?
Absolutely. Maybe a quick note. I'd say final thought on my end would be that when you think of patients, when you think of these rare diseases, when you think of patients, when you think of caregivers, the one thing I would caution everyone is that they're not monoliths. They're not, oh, because you have this disease, this is the way you are. I think Emily's point earlier regarding even symptoms and how certain symptoms, as dramatic and life altering as they can be, aren't necessarily experienced the same way across the board. I think when and even your example regarding AI and the use of AI, not all the patients and caregivers are the same level of tech savvy. Not some are, some aren't. And I think approaching these communities, it's approach with caution, approach with sincerity, approach with authenticity, and most importantly, approach with an attitude that you want to learn. I think that would be. I think that's some of the key things that we've learned. Emily, any final thoughts, and how can they talk to us?
No, thanks so much for having us. This has been a great discussion. If anyone has any questions, definitely visit our website, cadencecr.com. We are on LinkedIn. We have a great website. There's a couple videos on there that get a little bit more detail on exactly the work that we do and some great examples up there. So,
And
thank you.
email us. Mine is, I'll just say it, sbiswas, so SBISWAS at cadenceresearch.com. And Emily's is a little bit easier. It's E Anderson S at cadenceresearch.com. Please feel free to reach out to us. We'd love to engage. We are committed to the rare disease space and want to engage more anywhere we can help. We'd be happy to.
I recently met somebody at a medical device show that is starting a new rare disease venture, and I really appreciate your guys being willing to speak with her. I think you guys are just very genuine, easy to work with people, and we appreciate that. So I'll include for those people that are listening on the streaming services they just heard. If you're watching the video or through our website, I'll also have links on the website as well to make it easy for people to find you guys. Anyway, thank you guys. This was fun. I knew it would be. It's a sort of sensitive topic, an important topic, a human topic, and I learned some things today, so I appreciate you. Thank you.
Good.
Thank you so much.
Thanks, Derek. See you.